Hello anatomy friends, this is Dr. Alsup, and we spent quite a bit of time talking about the different structures of the vertebrae. And now we're going to talk about the main joints that you'll find associated with the vertebral column. And there are a lot of different types of joints. We're not going to get into some of the smaller ones. We're mainly going to focus in on these intervertebral discs. And so we'll talk about where these are located, what's going to make up an intervertebral disc, and then we'll talk a little bit about herniations of the disc. All right. So intervertebral discs are often referred to as the IV discs. Sometimes you could hear them even referred to as joints of the vertebral bodies because these will be located between bodies of the vertebrae. You can see it right here. These are actually examples of symphyses. If you recall our conversations of symphyses, these are a type of cartilaginous joint. Recall that all symphyses are going to be located in the midline, so those vertebral bodies certainly will fit into that as well. And you will have an intervertebral disc between each vertebral body, so each kind of set of neighboring vertebral bodies, except between C1 and C2, which makes sense because you have that dens that is going to kind of move into that region, so there's really not room for a vertebral body there. And you will not have any intervertebral discs between the non-movable or fused vertebrae of the sacrum and the coccyx, but you will have an intervertebral disc between L5 and S1, so between the last lumbar vertebrae and the sacrum. And the size of the intervertebral disc will vary in different regions. The discs will get larger the more inferior you get. So we are looking kind of at a lumbar region here, so you can see it can actually get quite large. The two components of the intervertebral discs are going to be the outer annulus fibrosus. This is usually the largest component. It is going to be composed of fibrocartilage. And an important thing to note, so if this is the posterior portion because there's a spinous process, and this is anterior because this is the body, this posterior portion of the annulus fibrosus is going to be a little bit weaker than what you have in the other regions. And that weakness, that inherent weakness, can have some implications in terms of herniations. In the middle, you will have the nucleus pulposus. And this is kind of a semi-fluid, mucoid kind of region. It will get smaller with age. Some of it can convert to fibrocartilage with age, but you typically will have some nucleus pulposus even into advanced age. And if you've ever heard of the term slipped disc, this is kind of the colloquial term for herniation of the nucleus pulposus. And what will happen is that inner portion, that nucleus pulposus, will herniate or escape where it typically is held. And it will do so because there's some type of damage or weakening associated with the annulus fibrosus and any of those other ligaments that are going to be in this region. And so if you have a slip disc, these typically will occur or be directed posterolaterally. So you can see in this one, this would be posterior again, this would be anterior, so you can see it escaping or kind of moving posterolaterally. This, as you can see here, this is the spinal cord, and this is a spinal nerve. So if you have herniation of the nucleus pulposus, it could feasibly compress on the spinal cord, but more likely it's going to compress on the spinal nerve right around that intervertebral foramina region, so where it's kind of exiting through the vertebral column. So you could have pinching of the nerve or compression of the nerve due to the herniation. And the most typical placement, or the most typical place for slip discs, are between the intervertebral disc associated with between L4 and L5, or between L5 and S1. because that lumbar region really bears much of the weight of the body. And you also have a lot of movement actually associated with the lumbar region. So it just most often will occur here because of those factors. All right, so this we just talked about, but it's an important concept. So herniation can happen at any intervertebral disc. So that's the important thing to note. You can have herniations at any level or at any location of where there's an intervertebral disc. But it's most common with intervertebral joints at which vertebral levels? Is it the cervical region, the lumbar region, or the thoracic region? So really the key here is where is it most common? And hopefully you recall our discussion just a moment ago that it is the lumbar region due to the fact that there's a lot of weight in this region. There's a lot of weight of the body occurring here. There's also increased movement of the lumbar region. So try to move your lumbar region. And you can actually have quite a bit of movement there. So that can lead to kind of a weakening in that area. Cervical, it certainly can happen there. Herniations are not, they're not all that uncommon in the cervical region. This would actually be kind of the second place that they would most likely occur. Thoracic is a bit more, a bit less typical, but lumbar is by far going to be the most common site. Okay, so that should wrap us up in terms of the intervertebral discs of the vertebral column. Remember, those are between the bodies, and they will increase in size the more inferior you get. Thank you for your time and attention here. As always, please feel free to reach out to me with any questions. And let's move on to the muscles of the neck and the back. Thanks for your time.